Welcome to Vastavam Health Hour. Today we have Dr. Rane, a famous dentist from New Jersey, USA. Let's see what she says about dental health and different common dental problems. Hello, Dr. Rane. Welcome to Vastavam. Thank you for your valuable time with us today.
Thank you, Prasad. Thank you for having me on your wonderful show today.
Thank you, Dr. Rane. So before we start talking about dental health, can you please give us a brief introduction about your professional profile and family?
Sure. So viewers, my name is Dr. Jahnavi Rane, and I am a general dentist. I run Rane's Dental, which is a multi-specialty practice in central New Jersey with a couple of offices. We provide all phases of dentistry for children, adults, seniors, with orthodontics, periodontics, general dentistry, everything under one roof. And I did my training at NYU Dental School, and then further on did some specialty training at Beth Israel Hospital in Newark and Harvard School of Dental Medicine. I've been practicing for about 18 years. I live in Plainsboro with my 3 kids and my husband. I have a son and 2 daughters, and I definitely enjoy practicing dentistry. Apart from that, I actually even love mentoring younger dentists. So I started a study club for dentists to just make their practices excellent and provide more superior service to our patients.
eclinicforyou.com. Better health for better life. eClinic for You is a virtual clinic. Our physicians will provide you health assistance and our expert second opinion for diagnosis. You can save your travel time and cost through virtual care. Connect with a medical professional within an hour. No insurance is required. $60 per visit. We take care of your health and we have qualified team of experts. To schedule an appointment or for more questions, you can call us at 903-884-6601 or email us at support@eclinicforyou.com. You can also visit our website www.eclinicforyou.com.
Wow, that's a great profile, Dr. Rane, and thanks for sharing with us. So let's start with the common dental problems in a healthy man.
So the most common dental problems is something that I think most people can relate to is a toothache because of a cavity. And the other thing is probably bleeding of gums and pain in gums because of maybe hygiene issues or not taking care of your mouth properly. So those are the most common things that we see in a dental practice.
Okay, so what causes gum diseases?
So gum disease could be a couple of factors. The most common factor causing gum disease is actually poor hygiene. Most people, don't go to the dentist regularly. So if you don't do that, there's stuff and places in your mouth that you cannot clean yourself. So that is one issue. The other thing is if you're not very good about your cleaning and flossing and brushing every day, which I have to say, not all people do it. It's very hard to be that compliant. And the other issue with gum disease is if you have any predisposing systemic factor, like if you're a diabetic or if you have heart issues or some kind of an immune deficiency in your body, then you could actually get gum disease. And gum disease is basically the swelling of gums because of bacteria underneath your gums, which causes them to bleed just by touching them. And also these gums are very puffy and painful when you touch them. So that's basically what gum disease is.
Are there any specific food habits that cause dental problems?
I mean, if you're having a lot of sugary foods and foods that could trap more bacteria in your gums, obviously it would predispose you to more gum disease. But generally, it's just the most important factor is not getting that stuff out from underneath your gums. It stays there for months, years, forms solid stuff called tartar or calculus, which then is a foreign substance. Your gums don't like it, your gums get inflamed. And that's where all the breakdown of all your structures supporting your teeth starts.
So, do you recommend brushing the teeth after each meal?
If you can brush after every meal, that would be perfect, but we're not in a perfect world, as we've learned already. But if you can at least try to rinse after your meals, that would be awesome. The most important thing is at the end of the day, before you go to bed, if you can floss, then you're able to remove all the stuff that's in between your teeth. It's mostly the stuff that's between your teeth that just stays there. You know, we brush outwardly, but people don't really necessarily get into the areas that are in between.
Okay, if we strictly follow this teeth cleaning process on a daily basis, do we still need to visit a dentist for every 6 months?
Yes, I would highly recommend that because there are areas that we just physically cannot get to. You need special instruments to go down there. And also, you know, you need a second eye to be able to see what's going on inside
Right.
your mouth because you cannot see yourself.
Yes, right.
Also, we need to take x-rays to see what's going on. So it's like a physical. You know, you go for a physical for your entire body. You need to go for a dental checkup once every 6 months for your mouth.
Dr. Rani, can you please tell us about oral cancer?
So oral cancer is a very interesting topic. One of the things that causes oral cancer is anything that makes your cells grow, I guess, you know, in an unnatural way in your mouth. And one of the factors is smoking and tobacco, just like it causes cancer in other parts of your body too. The other factor could be like an ill-fitting denture or an ill-fitting crown or something in your mouth that's constantly rubbing against your cheek. That could also eventually make these cells reproduce and grow into a tumor, which can be cancerous. And the third thing is human papilloma virus. It's a virus that is, you know, infects cells in your mouth and can also cause oral cancer.
Okay, so do you have any recommendations on preventing the oral cancer?
I would highly recommend to do an oral cancer screening every year. We have a special light in the office. It doesn't hurt. It's very, very, very minimal cost. And once a year with that light, we can actually detect if there is anything abnormal going on in your mouth. Because if there is something abnormal and it is caught early, oral cancer has a better prognosis. We don't want to let it go undiagnosed for a long time.
How do you diagnose oral cancer?
There is a light, like I said, it's called Velscope. We use it in our office once a year on every patient during their checkup visits. It lets us see normal cells versus abnormal cells. Abnormal cells doesn't mean that it's cancer, but then we want to follow it up and see that whatever it is, it could just be like a pizza burn or something like that. But if it goes away, that's great. If it doesn't go away, then we'll actually biopsy the area and send it for testing. And then the test results will tell us whether it's cancerous or it's something benign.
Okay, so is that part of yearly checkup process?
Yeah, once a year generally is recommended.
Okay. Okay.
Is there a cure for oral cancer?
Okay, so one of the cues with oral cancer is if you're feeling any numbness in your mouth. And again, this is not necessary just because you're numb that it is oral cancer. It could be anything else too. But if you have numbness in your mouth that is, consistent for a few weeks, then you should go get it checked out. If you feel like there is some kind of a tingly sensation in any area, go have it checked out. If you see any lesions in your mouth, most common places of oral cancer are the sides of the tongue, the base of the tongue. So if you feel like there's anything abnormal in those areas, go have it checked out. Also pain that doesn't go away, have it checked out. Anything that you feel is not normal, you should have it checked out, and hopefully it's not oral cancer.
Okay.
Is there any preventive care that you suggest?
Like I said, if you're a smoker, then obviously you're more predisposed, or if you have been a smoker, or if you chew tobacco or any nicotine products, it's probably you're at higher risk. Again, if you have something in your mouth that is not fitting properly, go get it fixed at your dentist, because that again could pose a risk. Also, most kids these days get the human papillomavirus vaccine. I would highly recommend that. I think it's recommended for kids once they're 17 or something like that. So those are some of the things that you should probably get done. And apart from that, obviously, if you feel like there is something abnormal going on in your mouth, have it checked out.
Okay.
What causes tooth erosion and how to prevent it?
Okay, tooth erosion is generally when your enamel on your teeth is the outermost layer of your tooth, is the hardest structure in your body. It's like the defense system of your tooth. So if there is a lot of acid on your teeth, if you're eating a lot of acidic foods, or if you're having a lot of sodas, caffeine, things like that, can actually start eating away at your enamel. That causes breakdown of the enamel, and then it makes your tooth more sensitive. So once your enamel starts breaking down, unfortunately, we cannot regrow enamel. You would have to use some kind of sensitivity toothpaste or put some kind of a crown or something like that on the tooth, so to protect your tooth, because the layers underneath are softer and the layers underneath have nerve endings. So two things will happen. Once your enamel breaks down, which is basically erosion of your tooth, then the layers underneath will start breaking down much faster and your tooth will start hurting because they have nerve endings.
Okay.
Dr. Rani, many people complain about tooth sensitivity. So what's the root cause of this tooth sensitivity, and is there any prevention for that?
Again, is two causes. One is your armor, your enamel is wearing away because either your food habits or something going on with your body that is causing your enamel to break down, or two, you have a cavity.
Okay.
So as soon as you get closer to the nerve inside the tooth, your tooth starts getting sensitive. Sometimes people also have recession of the gums. And when your gums recede, the roots of the teeth get exposed. Roots are not covered with enamel. So then your teeth could become sensitive.
Sensitive teeth are very painful.
Yes. You have anything cold or hot, it's going to
Right.
shoot through the roof.
But using toothpaste for teeth sensitivity is a temporary solution, right? It cannot fix it forever.
eclinicforyou.com. Better health for better life. eClinic for You is a virtual clinic. Our physicians will provide you health assistance and our expert second opinion for diagnosis. You can save your travel time and cost through virtual care. Connect with a medical professional within an hour. No insurance is required. $60 per visit. We take care of your health and we have qualified team of experts. To schedule an appointment or for more questions, you can call us at 903-884-6601 or email us at support@eclinicforyou.com. You can also visit our website www.eclinicforyou.com.
Toothpastes for that, but they will work for a certain amount of time, and then after that, if the erosion gets worse, then you have to do something like maybe cover it with a crown or put a filling on it or something like that.
What are the mouth sores, Dr. Rani?
So mouth sores could be caused by anything. It could be an allergic reaction to some sort of a food that you're eating. And I'm sure everybody's had mouth sores. They're very painful. And they take at least about a week to go away. But these could be caused by an allergic reaction to some sort of food. A lot of people have allergies to chocolate or nuts or some kind of toothpaste that they may be using, some agent in it that's causing the allergic reaction. Secondly, it could be actually because, again, there's something in your mouth that is cutting the area, the tongue, the cheek, maybe a bad filling that's broken down or cracked or something sharp on your tooth. That can cause a mouth sore. Or the third thing is you can actually get like a viral infection that can also cause mouth sores. So,
is it contagious?
Mouth sores can be contagious if they're a virally caused sore.
So from person to person, how it will spread?
Yes, it could be like a herpetic
Okay.
lesion. If it is, then yes, it could be passed on. So you have to be careful, make sure you get the medication. Either if it's a herpetic lesion, you could apply some kind of ointments, antiviral ointments. Otherwise, we also have like a mouthwash that we prescribe that could keep the person comfortable, at the same time helps to, kind of clean up the area and keep it infection free.
Is bad breath because of this source?
Not really the source. What happens is people brush their teeth, but a lot of people don't brush their tongues. So, especially people that have a postnasal drip. So when you sleep at nights, saliva pools in the back of your throat. Now that saliva stays there, and then it also mixes with the bacteria and everything in your foods and causes like this substance, phlegmy substance. If it stays on your tongue and you don't brush your tongue, then it can cause bad breath. And obviously all of this stuff, even if it stays around your teeth, can cause bad breath. So actually a lot of people that have a postnasal drip, unfortunately, are subject to more of a bad breath than other people.
Okay. Dr. Rane, can you please tell us about teeth implants?
Yes, actually implants are extremely successful. We've been doing implants for years now, but the newer implants are even more successful. We can even do them in patients that have like some kind of a health compromise. Initially, it was difficult to place implants in somebody with diabetes or had heart disease or something where the implant wouldn't take or wouldn't attach to their jawbone. But now the newer products are so good. They're like about 99% successful in most patients, even with any other systemic issues going on. So implants, once they're placed, they're placed in a bone. And unlike what people think, they're really not painful because they're placed inside your bone and your jawbone doesn't have any nerve endings. So placing an implant probably hurts even less than taking a tooth out or an extraction. So yeah, once an implant is placed and it adheres to your bone, it is pretty much for life.
What is Invisalign? Is it just for some cosmetic reasons, or it has some health benefits too?
Invisalign is the invisible way of doing braces. So instead of having metal wires and brackets on your teeth, they are trays that fit over your teeth, and they're almost invisible, they're clear. So people can't see them when you're talking. And most adults like doing Invisalign because they can go about their everyday, talking, working. They don't hurt because there's no wires and brackets. Very easy to clean because you just take the trays out, clean your teeth and put them back in. And they gradually push the teeth in a nice alignment wherever they're supposed to go. So Invisalign is not just cosmetic, I would say. Any kind of straightening of your teeth is not necessarily just cosmetic. Yes, it has a big cosmetic component because it alters looks. But there's a lot of other benefits also for straightening of teeth.
Can you please explain more about the benefits of straightening the teeth?
So one is if teeth are in a nice alignment, teeth like to function as a group. So if they're aligned properly, they're going to take equal forces of your chewing. And if you're biting with equal forces on your teeth, you're going to be able to keep those teeth longer. You're going to have less chances of one tooth taking more trauma and cracking or breaking over time. And also it's going to be less of a load on your jaw joint. A lot of people end up with having a lot of TMJ, temporomandibular joint pain and stuff like that. That is because a lot of their biting and chewing forces are not distributed equally amongst their teeth. So one benefit of aligning your teeth is distributing the forces equally. Another benefit is people actually have now found a relationship between narrow arches and snoring. So if you're able to expand your arch, it's easier for people to breathe, and people actually stop snoring or snore less at nights because they're able to take in more oxygen. Because what happens is if your arch is narrow, your tongue sits in your palate and it kind of obstructs your breathing at night.
Okay, so how long an Invisalign takes to fix the teeth alignment?
It depends on the patient, very honestly, and the type of teeth, like how misaligned they are or how their arches are. So it could, on an average, I would say about 12 months.
Oh, so they have to wear it for 12 months?
Okay.
But it doesn't hurt. It doesn't interfere with your speech or anything. It's actually a phenomenal invention that was made a few years ago. And even kids these days prefer using Invisalign because, nobody
Right.
wants metal wires and brackets unless absolutely needed.
Are there any side effects of wearing that?
No, not at
No?
all.
Okay.
Only thing is you have to remove them when you're eating or
Okay.
drinking, brushing it.
Okay.
So, Dr. Rani, why did you choose dentistry? Is there any special interest in this field of medicine?
So I actually love interacting with people, and dentistry is one field. And I always wanted to be in healthcare. So being a doctor, but being able to constantly interact with my patients, we have so much time when they're in the chair for me to talk to them and discuss other things. And so I love the social interaction with patients. The other thing is, I think it's I get a lot of satisfaction in making people smile, and that's one of the primary of
Like, that's really good. Okay.
yes, and I also I think image is extremely important in today's world for everything. So
Right.
if any way that I can help people feel more confident about themselves um, and alter and improve their health at the same time,
Right.
it's something that gives me a lot of pleasure. So.
Okay. Okay.
So, what do you do in a free time, or you don't have a free time at all?
Oh no, I mean I find time to do things that I want to do. So apart from dentistry, of course I have my study club, which I really enjoy because there's a lot of other dentists that have now become friends that we're all kind of collectively growing our knowledge and everything. So that's also kind of enjoyable for me. But apart from that, I do a little bit of public speaking and do some modeling, do some
Oh, okay. That's nice.
a little bit in the entertainment world too, so which I enjoy.
Oh, that's nice. So, doctor doing modeling is a really very rare combination, I think. That's
More
good.
Wow, that was a very valuable dental health information you shared with us today. Once again, thank you very much for your valuable time, Dr. Rani.
Thank you so much again, once again, for having me on here, and I really enjoyed speaking to all of you.